All right, well, thank you guys for coming. We'll get started. Tonight we're going to be talking about adenotonsillectomy, which is basically removal of the adenoids and the tonsils. And we're going to talk a little bit about when and why we would do this kind of operation. It's a very, very common surgery. About 500,000 kids a year get this surgery. And it's one of the most commonly performed operations in children. And it's generally done for two basic reasons. One is either recurrent tonsil infections or problems with the airway. In other words, not getting enough air from the nose down into the lungs, and the tonsils and the adenoids are in the middle of that airway pathway. And so if they are enlarged or causing problems with that, then that's one of the reasons why we would take the tonsils and the adenoids out. So this gives you a little bit of the anatomy. This is a cross section, what we call a kind of a sagittal view of the upper airway. So you can see here, this is the eyes looking forward. This is the tip of the nose. These are some of the tissues inside of the nose. And then as you go further back, this is where the adenoids live. Okay, they're at the very back of the nose, and they are essentially the same kind of tissue as the tonsils that we see through the mouth. They just happen to be located in the back of the nose. And then as you go further down, you can kind of see where the tonsils stand. Okay, and this is how air goes through the nose and down into the windpipe and into the lungs. This is probably a view that we're all kind of more familiar with, looking directly by opening our mouths. And I'll show you a little bit of the anatomy here. This is the area called the soft palate, okay, which is basically the floppy portion of the back of your throat that moves when we talk and we breathe. This little dangly thing is called the uvula, okay, and there are two little pillars called the anterior pillar and the posterior pillar. So basically, the tonsils are housed in between this front pillar and the back pillar, okay? And so you can kind of get a picture of this front pillar right over here, and the back pillar, you can kind of get a glimpse of that right over here. So the tonsils typically stay within those two pillars, and you've got a tonsil on either side. In this picture, the tonsils are of the same size, and generally that's what we see. Occasionally there are instances where one tonsil can be larger than the other, in which case we need to evaluate why that might be. Okay, so let's talk a little bit about the symptoms of obstructive sleep apnea. So sleep apnea is where there's not enough airflow going from the nose into the lungs, nose, throat, and into the lungs, and that can cause your oxygen levels to drop at night, which causes all kinds of different symptoms. And so some of those symptoms are snoring. So snoring is a common symptom of obstructive sleep apnea, but it's important to note that not all snoring is sleep apnea. So there are a lot of people who snore, who have vibrations in their airway that cause the sound of snoring, but don't actually have sleep apnea. Okay. So snoring is common. Daytime sleepiness, well, you can imagine that if you're not getting a proper amount of rest at night, you'll be tired during the day. So daytime sleepiness is a very common symptom of obstructive sleep apnea. Apnea is basically gasping for breath at night or blockage of airflow. So if the air, as you know, when we breathe in, we should get air going into our lungs. Well, if we're attempting to breathe, but air is not flowing, that's what we call apnea. And it's typically, you see that in a patient who has sleep apnea that will have snoring and then all of a sudden will stop snoring or gasp for breath. That is typically what we would think of as an apneic episode or apnea. In kids, especially, we see a lot of bedwetting. And I'm not sure that we exactly know why that is, but bedwetting is a very common symptom we see in kids who have sleep apnea. Ironically, adults typically don't have that problem with sleep apnea, but kids can. Morning headaches are another symptom of sleep apnea. And the reason that people can get morning headaches is because when we have sleep apnea, There is a, normally when we breathe in oxygen and we exhale carbon dioxide. And what happens is if you are not able to get that flow in the proper ratio, you're getting less oxygen in and you're having a more difficult time getting carbon dioxide out of your body, because if you're not breathing well at night. So as a result of that, you get an accumulation of carbon dioxide, which is basically a byproduct of our breathing, and it has more difficult time coming out, and so as a result you can get morning headaches. Irritability is also very common in patients with obstructive sleep apnea because of not getting proper amount of rest. It can cause you to be sleepy, can cause you to be irritable, and we see this a lot in kids. A lot of kids that we see that are labeled ADHD or attention deficit hyperactivity syndrome oftentimes have sleep apnea as one of the components. So pediatricians will sometimes send a child over to us to be evaluated for sleep apnea prior to starting ADHD medication to see if that's one of the causes of their irritability. Nasal obstruction is, as I always say, the airway is like a pipe, and the very top of the pipe is the nose. And so the nose is very central to breathing, and if you can't breathe well through your nose, that can be a symptom of sleep apnea. And behavioral abnormalities oftentimes relate to the irritability and the daytime sleepiness. So we've talked a little bit about the obstructive sleep apnea symptoms. And if you remember back from the very beginning of the talk, one of the two reasons why we would take out the tonsils and the adenoids are for obstructive sleep apnea and for recurrent tonsillitis. And tonsillitis has a series of symptoms. Oftentimes tonsillitis is accompanied by fever due to an infection within the tonsils. Sore throat, you can imagine that if every time we breathe, talk, swallow, eat, your tonsils get irritated, and so if your tonsils are irritated, you can see why you get a sore throat, because it's right in the middle of all those activities. Difficulty swallowing or breathing. A lot of different muscles around the tonsils have to be activated in order for us to swallow, and so think of having a bruise on your leg, and every time you move, that bruise gets irritated. And it's the same thing with the tonsils. So if you have problems with a tonsil infection, every time you try to get food past there, it's another source of irritation. And so difficulty swallowing is very common. Difficulty breathing due to the size of the tonsils. So when they get infected, they can swell. And when the swelling occurs, that can lead to blockage of airflow. And so oftentimes we see kids who have problems with breathing only when they have these tonsil infections. So their tonsils normally aren't a problem in terms of size, but when they get infected, they can swell, and as a result of that swelling, that can lead to difficulty with breathing. Change in voice, that's another symptom of tonsillitis, because as sound comes from our lungs and through our larynx or voice box, it also reverberates through the upper airway. And so if the tonsils get swollen and irritated, that can affect the resonance of sound as it comes up. So we all experience colds, and we know we sound differently. Even people on the phone will tell us, are you sick? And then the reason for that is because you typically, when you have a cold, you have some amount of swelling in your nose or your throat, and that's affecting the reverberation of sound or the vibration of sound as it's coming out from the voice box. So redness of the tonsils is another sign of tonsillitis, so it can be swollen and it can also be red. So what do we look for in terms of physical exam findings in patients with tonsillitis? So one of the things we look for is a symptom called hyponasal voice. So hyponasal voice meaning that air is normally meant to come through our nose from the voice box into the nose during certain sounds. And so if you have blockages of the tonsils and the adenoids, that can lead to less airflow out of the nose during certain sounds. And so we call that as a hyponasal voice. And that's the typical sound that we get when we get a really bad allergy attack, or we have a bad cold and our nose gets stuffy. That's the kind of voice that's sometimes seen in patients who have adenoid and tonsil problems. Bags or bluish tinge underneath the eyes, that's a classic sign of not being able to breathe well through the nose, and so the adenoids can be one of the things that can cause problems with breathing through the nose. And as a result of that, there can be bluish tinges underneath the eye. A lot of the blood, as it drains from all throughout her head, passes kind of through the nose, and there's a backup of the blood flow when the nose is blocked, and that can be seen as bluish tinges underneath the eyes. Open mouth, so you see a lot of kids, I think I may have a picture of this later on, who commonly open their mouth because if they close their mouth, they can't breathe well through their nose. And so we commonly, pediatricians and parents oftentimes refer to this as he's a mouth breather. Well, he's a mouth breather because he can't breathe through his nose, because we're all designed to be able to breathe through our nose. And so if we're not able to breathe through our nose, we breathe through our mouth and adenoids. A high arched palate. So the palate, again, is the roof of your mouth. And as you know, as kids grow, there's a lot of changes to their middle portion of their face. And so one of the things that we can look for to see if a child has been having problems with their airway is what is the shape of their palate. And so generally a palate should be more kind of flat, and if it's more arched like this, that's a classic sign of nasal obstruction. Okay? And so one of the things that can cause nasal obstruction is the adenoids, and that's one of the things we look at. So occasionally we'll see a patient that is referred to us by an orthodontist because they've got all kinds of problems with their teeth, and the orthodontist is going to want to try to align those teeth. Well, one of the problems that they can run into is that if the palate is really arched, everything is crowded, and so they don't have room to be able to get the teeth back into alignment. So before they'll put a child into braces, they will contact us to evaluate for the tonsils and the adenoids and any other nasal issues to see if we can broaden the palate so that the orthodontist can now have more room for the teeth to get more space. So you can see that obstruction of the airway can lead to dental problems, especially in kids. Turbinate enlargement is another thing we look for. So the turbinates are swellings on the side walls of our nose, and the turbinates help warm and humidify the air that we breathe. And normally they are meant to warm and humidify the air, but not obstruct the airway. And so turbinate enlargement is something that we see in patients who have allergies or some other type of inflammation, and that can lead to disturbances in sleep and oftentimes coexist in patients who have adenoid and tonsil problems. So when we look at the tonsils, we kind of grade tonsils. So if you've ever been to a doctor before and had your tonsils looked at, they may have said, oh, that's a 2+ tonsil or a 3+ tonsil. Well, what does that mean? So, so 0 is when the tonsils have been removed. So this is what it would look like. You see, you can get a better sense of those two pillars that we talked about earlier. This is the front pillar and then the back pillar. So if they're confined kind of within the pillar, they're a 1+ tonsil, okay? And if they extend kind of beyond the pillar, they're a 2+ tonsil. If they extend well beyond and kind of almost near the midline, they're a 3+, and then a 4+ is kind of when they're touching. So oftentimes you may have heard this phrase, kissing tonsils, where kissing tonsils mean when both of them are, you know, obviously touching each other, when they shouldn't be that big. So that's usually a sign of another underlying problem. So we're all familiar with kind of looking at our tonsils. We probably look at them every day when we brush our teeth. The adenoids are a little bit more difficult area to examine. So this is done with an endoscope, or a little telescope through the nose, looking at the back of the nose. The reason that we do that is because it's very difficult to be able to examine the adenoids without a telescope. you could theoretically go in with a little mirror behind the back of your throat and reflect it up. And we can sometimes examine the nasopharynx or the area where the adenoids live in the very back of the nose, but that's a very, very difficult thing to accomplish in most patients. And so this is done with a little endoscope. And so just to orient you, this is the right nasal cavity. So this is this part right over here is called the nasal septum, which is the middle portion of the nose. This is the turbinate, we talked about that earlier, and this is where the adenoids live. So if you look at the adenoids, they look exactly like the tonsils, they're just in a different location. And here's a clearer view of that on the left side. So this is the right, and this is the left. And again, here's another view of the of adenoids that are significantly enlarged. And this is an example of 4+ tonsils. So this is just a tongue blade pushing the tongue down, and you can see how large these tonsils are. They're actually touching each other. Okay, so what can you do to kind of reduce your risk factors for your kids and grandkids? People who are of healthy weight obviously have an easier time with breathing. We've kind of anecdotally known that, but the main reason for that is because the airway you have a larger requirement for airflow the larger you are. And weight, especially abdominal weight, tends to limit the ability of the lungs to expand, because when the lungs expand, they expand down. And so with extra weight makes it more difficult for the lungs to expand, which can lead to airway problems and sleep apnea. Treating nasal obstruction with and allergies with saline rinses and topical sprays are also very helpful. And we've just recently, in the last 10-15 years, have come to appreciate the role that the nose plays in sleep problems. Before, it used to be pretty ignored in terms of sleep issues, but at night, the nose, when we lie down, blood tends to rush towards the nose. And so it's very important which causes more swelling of the nose. And so problems that aren't as pronounced during the day can become more problematic at night when we lie down and all this blood rushes to your head, which means the tissues in your nose can swell. And so that brings out a lot of problems that we may not notice during the day. Flushing out the nose and cleaning the nose and applying a topical spray to help control the inflammation is sometimes necessary to reduce the risk of airway blockage. Caffeine is a stimulant, and especially in kids, should not be used, especially in the evening hours, because that can really disturb sleep. Maintaining regular sleep times and patterns. We're creatures of habit, and so if you can establish a regular sleep hygiene in terms of going to bed and sleeping good 7 to 8 hours a night, even more important for kids to make sure that they get at least 8 hours of sleep. Sleeping on your side is also helpful, because as you can imagine, if you lie on your back, basically all of the tissues collapse backward, and it makes it a lot more difficult for you to be able to get airflow through. If you sleep on your side, you have a lot less risk of having blockages of your airway. So those are some of the things you can do to reduce your risk factors for sleep problems and airway obstruction. So what are the treatment options for this? So there are certainly some non-surgical options, and so controlling inflammation in the nose is something that's important. And if you can control the inflammation in your nose, you may be able to secondarily control some of the inflammation further down, because the less stuff that drains from the back of the nose, the less irritants that you might have for your tonsils. So that might help you as well. Gargling with a little bit of hydrogen peroxide is something that can be done if you have a lot of pits and pockets within your tonsils and some stones and mucus that kind of accumulates in there. You can kind of flush out those pits and pockets with some hydrogen peroxide. Just make sure you don't swallow any of that stuff. It's not the best tasting stuff. And then if you have chronic tonsillitis, maintaining good hygiene in terms of not spreading strep infections. So not eating off of the same plates and spoons and drinking out of the same cups, maintaining good hygiene, using a lot of hand sanitizer and so forth, and that plays a significant role. And we see a lot of kids, especially in a daycare or school-like setting, one child develops strep and then next thing you know, the whole class has strep. And a lot of that has to do with some of the poor hygiene habits that youngsters sometimes partake in. Okay, and then in terms of surgical treatment, we can remove the tonsils alone. That's called a tonsillectomy. Sometimes we do these surgeries individually. Sometimes we do them as a group. The tonsils and the adenoids can be done separately or together. We talked about the turbinates being enlarged, and so sometimes we reduce the size of the turbinates to provide more room for airflow, and so that can be done in conjunction with this surgery occasionally. What are the risks of the surgery? So as with any operation, there are risks involved with a tonsillectomy. It's a relatively quick operation, but it's a big surgery. Having your tonsils taken out is not something you want to take lightly. It's a very very painful surgery for the patient for about 2 weeks. The other risks are bleeding. So 1 to 2% of the time, bleeding can occur to a point that would sometimes require another trip back to the operating room to control the bleeding. Again, this doesn't happen very often, but when it does, it's an emergency, and that's something that you should be aware of before entertaining the surgery. So infection is a risk. Scarring. So anytime you make an incision in the body, there's always a risk of scar formation. Fortunately, it's not very common. It's very, very rare, but scarring can occur in the back of the nose, which can affect speech and swallowing. Scarring can occur in the tonsils. There's usually less of a consequence if there's scarring within the tonsils. Most of the time, the scarring that can be problematic is scarring that's related to the adenoidectomy. Pain we talked about, and change in voice. So as you can imagine, we talked about the reverberation of sound as it comes out from the voice box. So if you've got tonsils and adenoids that are blocking that sound, and then all of a sudden you've removed the tonsils and the adenoids, that can change your voice. So think of how your voice would change from when you have a cold to when you don't have a cold, and it would be the same kind of thing here when you have your tonsils and your adenoids and when you don't have your tonsils and adenoids. But most of the time, I will tell you that patients are very happy with their new voice because they sound more normal than what they did before they had a tonsillectomy and adenoidectomy. So surgical candidates. So when would we want to do surgery? And so the requirements for a tonsillectomy and adenoidectomy have become a lot more strict in the last few years. And our academy came out with new guidelines over the last couple of years. And new guidelines are actually 7 infections in 1 year. Okay, so that's a pretty significant number of strep infections. 5 infections for each of the last 2 years. Okay, and there's a third category which wasn't clearly delineated in the article, but 3 to 4 cases of tonsillitis for the last several years is a reason to consider a tonsillectomy as well. And then lastly, one of the main indications, and probably one of the top indication now, more than tonsil infections, is obstructive sleep apnea. And that doesn't always have to be diagnosed with a sleep study. We oftentimes go based upon patient's history, and if the history and the physical exam support a diagnosis of obstructive sleep apnea, that is an indication to proceed with surgery if necessary. So what does the research say? So very pertinent in the New England Journal of Medicine, which I'm sure you guys have heard of before. It's a very prestigious medical magazine that covers all aspects of medicine. And there was a good study in the June edition of this that studied roughly 800 kids, okay, who had obstructive sleep apnea. And so what they did was they had 2 arms. So they took about 400 of those kids and observed them. And they took about 400 of those kids and they underwent tonsillectomy and adenoidectomy. And they watched them over the course of the next 6 months to kind of see how each one of them, how each group would do. And so they found that the group that had the tonsillectomy and adenoidectomy, tonsil and adenoidectomy, actually did better in terms of their quality of life improvement and their parameters of sleep apnea, so they had less obstruction of airflow and a better quality of life. that's all we have. And I'm all right.
Good job.
Okay, thank you.
Dr. K.
Thank you.